If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then online oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Everybody to another session of Be Smart, Fight Strong series of educational videos for the cancer patients. I'm Dr. Riaz, and today we will be discussing a very important topic about nutrition in cancer patients. So what is nutrition and why it is so important? Just like a car needs gas to run, we all need food. That's our gas to run. And nutrition, especially in the setting of cancer, is even more important. Actually, in my opinion, the nutrition is as major of a player, if not more, as other modalities we use to treat cancer, like chemotherapy, surgeries, and radiation. And malnutrition in itself is a very poor prognostic indicator, meaning that the patients who are malnourished, they do not do well in both short and in long term along the course of their cancer. So what is malnourishment? It's actually a deficiency of one or more nutrients in your body. Now, there are several factors in a cancer patient why the malnourishment can develop, but before we get to that, let's discuss why it is so important to have a good nutrition during the course of your cancer treatment. Number one, good nutrition has a lot of therapeutic benefits. Just like I said, that it is also a major player and a predictor of your well-being during the cancer treatment. And it is not only that good nutrition is needed for everybody, but during the cancer, it's even more important, and it has a lot of therapeutic benefits. Good nourishment is very important for a healthy immune system. Now we know that our immune system is a major player, and a good nutrition helps maintain a strong immune system. When the immune system declines, a lot of problems can happen with that. You are at increased risk of getting more infections. The immune system in a cancer patient is usually depressed. It's partly from the cancer itself, and it is also from the treatments like chemotherapies that the cancer patients get. Therefore, good nourishment helps keep a healthy immune system. The immune system not only protects us from the infection, but it also protects us and gives us a good control over the cancer. And that is actually the principle behind developing immunotherapies, which is a new class of medicines that we are using to treat cancer. And the idea is to boost the immune system. So one of the best ways that you can boost your immune system is by maintaining a good nutrition. Malnourishment decrease our body's ability to heal. Now, healing is a process that's been going on in a cancer patient all the time. When you have a surgery, you need healing and your tissue need to be repaired after the surgery. The wounds from the surgery need to be healed, and that healing is very much dependent on the nutrition. People who are malnourished, their wounds take longer to heal. They also take longer to heal after getting chemotherapy or after getting radiation therapies. Therefore, healing process is very important in the care of cancer, and the healing is much faster with good nutrition. Good nutrition also helps overcome fatigue. If you have undergone any cancer treatment, you know that fatigue is a major problem during the course of cancer treatment. And a good nourishment actually helps overcome that feeling of fatigue and low energy. Therefore, keeping good nourishment will help you a lot overcoming the feeling of fatigue in a much faster time. Patients who are malnourished, they experience more side effects of the chemo and radiation therapy. Therefore, maintaining good nutrition is very helpful in minimizing all those side effects. So the duration of the side effects will be much smaller, the recovery will be much faster from all those side effects, which will enable you to get more intense treatment and withstand them, which will increase your overall outcome from cancer. Well-nourished patients overall enjoy a very good quality of life compared to people who are malnourished, provided all other factors are the same. Let's take a brief look at what are the causes of malnourishment in a cancer patient? In a cancer patient, there are so many different factors that are playing a role. Overall, the appetite is usually depressed when somebody is fighting cancer and they are getting different treatments for cancer like chemo and radiation. So therefore, having a low appetite can decrease your willingness to eat food and get nutrition. Another common problem during the course of cancer treatment is the persistent nausea and vomiting. That could be from the cancer itself, or that could be from the treatments you are getting for cancer. And when you are constantly nauseous, you don't feel like eating, which can in turn cause severe malnutrition. Certain type of cancers like head and neck cancers, patients have difficulty swallowing food. They have dry mouth, and that can decrease your ability to get proper food and nutrition. Similarly, certain other cancers of our digestive system can decrease the ability to absorb those nutrients from the food, and that can cause malnutrition. Patients who have issues with the pain are on a lot of pain medication, especially the narcotic pain medication. And what those medicines do is they depress your appetite, so you don't feel like eating. Other chronic medical problems like diabetes or inflammatory bowel disease can decrease your body's ability to absorb nutrition. Now, how do we assess for malnutrition? There are some tools that you can use to assess for malnutrition, and actually some of those tools are available online. Usually every good cancer center has a nutritionist. So therefore, if you are having any problem and you think that your nutrition might be a problem, you can always ask to see a nutritionist and have a visit with her, and she will identify and do the risk stratification for you and identify all the areas that need to be improved so that you don't get malnourished. Doctors sometimes use certain lab parameters to check for malnutrition. One of the very important lab parameters that you can track is the serum albumin. It is a test that almost every time you get a blood work at an oncologist office, they run serum chemistries, and albumin is a part of that. There is another test called pre-albumin, which is a more accurate index in the short term how your nutritional level is. And if your pre-albumin levels are low, that is the time that you become proactive and start focusing on good nutrition. Similarly, the doctors can run some other tests like checking your iron levels, checking your vitamin levels, and they can assess your overall nutritional status. Now, how do we manage malnutrition? So each individual patient is unique because their cancers are different, the treatments they are getting are different. They might have individual factors that are playing major role in an individual patient. Therefore, identifying those unique risk factors for each individual patient is very important. Usually the type of the cancer you have, the location of the cancer, the different types of chemotherapies that you are getting, if you are getting radiation or not, will determine how much of a risk are you at of developing malnutrition. Certain tools you can plug in your information online and they will tell you what degree of malnutrition you have. Now, let's talk about the different tips and tricks that you can use to make sure that you are getting adequate nutrition from your diet. The first thing I want to touch base on is the method of nutrition. If you can eat diet by mouth and you have no trouble with swallowing and you have no problem with your digestive system, then the best thing is that you make sure that the diet you are getting is healthy and nutritious. Now, again, just like I said before, that your individual profile might be different from the other patient. For example, if you have diabetes, then you need to make sure that you are not eating foods that are high in glucose or that have refined sugars. However, if you don't have that, then you can go a little bit more liberal and your choices will be different. Therefore, if you have no problem eating or drinking, then you need to make sure that you are getting a healthy portion of protein, carbs, and fats in your diet. And you need to make a chart and track all that, your intake on that chart, and consistently follow that so that you ensure that you don't get malnourished during the course of your cancer treatment. Some people may have had this very hard for them to swallow. Usually in these patients, we often get a feeding tube. That feeding tube is placed inside the stomach or sometimes in the small intestines, and they can get certain formulas. There are some commercially available formulas like Ensure or Boost, and then the nutritionist can recommend certain other formulas that they can use and take that liquid diet through that tube to ensure that they are getting all the daily nutrition that they need. And then another form of nutrition that you can get is through IV. Now, that is an extreme step. However, there are a lot of patients that may need IV nutrition, and usually these are the patients that even they are getting nutrition by mouth or using a feeding tube, still their body is not absorbing all those nutrients from the diet they are getting. And usually in these patients, IV nutrition, which is also called TPN, that stands for total parenteral nutrition, that is an option for them to take. Usually the common situations that you use that is that when you are getting some treatment which is causing persistent nausea and vomiting, and the chemo or that treatment is very hard, and despite using the medicine you are still struggling with that, or you just don't feel like eating because you have no appetite. So to give an extra boost, the doctors may add IV nutrition. But at the same time, while you are getting that, provided you don't have any other problem eating or taking the food through your feeding tube, you should also continue to do that. Remember, you always need to use your gut if there is no problem in using that. Then poor appetite is a major problem for cancer patients. However, you can discuss with your doctor if there is any medicine that you can take to boost appetite. There are some prescription medicines that you can take that will boost appetite. In my experience, they are worth using whenever you need them. And although they do not work 100% of the time, but it's still worth to take them and try them because you may be somebody that they work on. CBD oil, which is legal in United States, is also an option. And I have some patients who report that they feel improvement in their appetite by using the CBD oil. If you're struggling with protracted nausea and vomiting, then your doctor can prescribe you several different medicines with different mechanism of actions to help you overcome that nausea and vomiting. And a good trick will be that before you plan to eat, like 20 minutes before that, you take the anti-nausea medicine and let it kick in your system, and then you try to eat something, and hopefully the odds are that you will be able to keep your food down by doing this. Some patients experience a lot of dryness of mouth, and it is hard for them to swallow solid foods. For these patients, there are some medicines available to stimulate saliva production, and your doctor can prescribe you those medicines. There are actually some over-the-counter medications that you can get that will stimulate the saliva production, keep your mouth moist, and in that way it will be easier to swallow solid food. Another trick for dry mouth is that you take the food with small sips of water. Then some people struggle that they are not able to eat in large portions, therefore their intake is very limited. So for those patients, they have to get all the nutrition in the smallest possible quantity. So for them, I would recommend that they get high protein shakes so that in a small quantity they get the adequate amount of protein and calories. Thing they can use is sprinkle some protein powders on their soup or in a puree food which is easy to swallow. And you have to make sure that the food that you are taking is small in quantity, but it should be concentrated in all the nutrients so that with a small quantity you still get all the nutrition you need. Some people struggle with the smell of the food, and usually that's a problem when you are having a hot cooked food, and smell of the food make them nauseous, and these patients have a really hard time eating that food. For them, my recommendation would be that they try cold food, like ice cream is good for them. Ice cream does not have any smell. So, and they can sprinkle some high protein shake on that ice cream, or some high protein powder on that ice cream, and take it. In that way, they will be getting enough protein and calories from that food. Now, at the end, I would like to emphasize on goal setting. Every single day, you need to set a goal as to how much you need to be consuming the food. And it really doesn't matter. You have to see what food works best for you based on your unique situation. But a good thing is that you make a small checklist and see that how much daily water you're going to take, how much protein you want, in what form you are able to consume them. Therefore, goal setting on a consistent basis is very important to ensure that you are getting all the nutrition that your body needs. You should ideally eliminate any alcohol intake during your treatment, especially when we are doing chemotherapies. Alcohol can interact with those chemotherapies. Alcohol is actually a chemical that your liver need to process, and the liver is also processing a lot of chemotherapies. Therefore, it's never a good idea to consume alcohol during your treatment, even in the smallest quantity. So my recommendation is that you completely eliminate alcohol from your diet. Another important trick is to add a multivitamin to your food intake. A good multivitamin is a good idea because, again, since you are suffering from malnourishment, there is a good chance that you may also have some vitamin deficiencies, and those vitamin deficiencies can cause a lot of problems. And sometimes you don't get any symptoms, but they can be a problem in the long run. So therefore, adding a multivitamin to your daily intake is an important thing. Then water intake. Water intake is very important. You can eliminate or decrease a lot of side effects by correcting your dehydration. And dehydration can develop very easily during the cancer treatment. Again, a goal setting just for water intake is very important. When I am doing hard chemotherapies, I put patients on a regular schedule to get IV hydration if I suspect that patient will not be able to maintain oral hydration at home. And a lot of patients, you can offset a lot of side effects of the chemotherapy by keeping good hydration. Again, because of the nausea, vomiting, because of other factors that are going on, your water intake might be low. In those situations, you can discuss with your doctor if getting the IV hydration after chemotherapy is a good idea or not. Sometimes I put my patients on a scheduled IV hydration, like 3 or 4 days after chemo, and then in another 7 to 10 days after chemo. And I have seen very good results with this strategy. Now, the end of this video, I would like to discuss, sometimes the situation is so hard that no matter what you do, people are still not able to get all the nutrition they need, and their diet intake is very low. And despite the doctors using different medicines and different tricks, still the intake is not adequate. My advice in that situation, when nothing else is working, is that you don't be picky in your food intake. Then you try to eat the foods that you like and not worry too much about if that food is healthy or not, because taking some food, even that food is not healthy, is better than not eating anything. If you're not gonna eat, you're gonna get malnourished within a few days to weeks. So therefore, malnourishment can set in very fast in cancer patients. Cancer itself is a very catabolic state, meaning that it is consuming the nutrition from your body. Therefore, when you are fighting cancer, you are not only feeding yourself, the cancer is also feeding off of your body. Therefore, you have to take the nutrition in more quantity than in a regular situation, because the cancer gonna steal a lot of nutrition from your normal body. That's all I have on the topic of nutrition today. I will see you guys soon with some other important topic.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.